All right, you're live.
Okay, thank you. Welcome back virtually to members and welcome all viewing the meetings remotely. Before we begin, I have a few notes to announce about conducting virtual meetings. The meeting still must comply with the regulations of the Open Meetings Act. Accordingly, the public may view the meeting via a link provided at the advertised agenda, which can be found online at the KDE website. LSAC members must ensure the video is streaming and they can be seen throughout the duration of the meeting. Members may mute their microphone when not talking. However, all discussions must be broadcast to the public. Therefore, superintendent should ensure their microphones is not on mute when speaking. For any items that require a vote, a roll call vote will be necessary to record the vote of each superintendent. And please mute or turn off cell phones or other mobile devices so as it to not interrupt the meeting. That being said, let's move on to item number 1, regulations for review and action. This addresses 702 KAR 1:195E, face coverings in school facilities. Commissioner Glass.
Thank you, Mr. Chair, and good morning to the members of the committee. I'm appreciative and grateful for you coming together so quickly to provide feedback on the proposed emergency regulation to the Kentucky Board of Education. This emergency regulation comes as the state is experiencing an alarming surge in COVID-19 infections and hospitalizations, and an accompanying a troubling rise in the number of cases among our young people. While Governor Beshear has also issued an executive order on this matter set to expire 30 days from issuance, KBE's authority is separate from the governor's, and the board also has an obligation to take steps to protect the health and safety of Kentucky students. The emergency regulation that the board is considering requires universal masking for a period of up to 270 days, or at such time the state board rescinds the regulation. And I understand that the 270 days is a concern, so I'd like to address that. The reason for the 270 days in the regulation is because of the state statute that specifies the length of time for emergency regulations. It is not something that we arbitrarily put into the proposed emergency regulation, and none of us wants to be in a position where we're requiring masking for 9 months. Still, based on feedback that we have received, KDE will recommend, in addition to the board's motion later today, which we think will satisfy some of the concerns on the time issue. While the proposed emergency regulation currently does indicate that the board can end the requirement at any time, we'll recommend that they add language into their motion directing a state board meeting to be called upon either the CDC or the Kentucky Department of Public Health changing their recommendations for universal masking in schools. So we've created that language and made it available for the board's consideration. We believe that clearly communicates the state board will closely monitor this issue and that it's not the intent of the board to require masking any longer than what is necessary. We believe that it's also superior to putting in some kind of arbitrary date of expiration in the motion when our circumstances and conditions regarding COVID-19 continue to be so dynamic and shifting. Another difference from Governor Beshear's order that we're recommending is that KBE's emergency regulation allow for people not to wear masks if they're alone in a room. The governor's order isn't clear on that point, but we've conferred with public health on this issue, and they agree there's a very low risk of an individual alone. So we've added that language into the emergency regulation that KBE is considering. Mr. Chair, I know you and the other members of the committee have had the opportunity to see the proposed emergency reg, and I appreciate your flexibility and your being available to meet on it today and discuss it. We look forward to hearing your input on this regulation and in supporting you in bringing your recommendations to the Kentucky Board of Education later today as they consider this matter. At this time, I'd like to invite Todd Allen to review the components of the emergency regulation with you, and then we're glad to answer questions and support you in compiling any recommendations that you have for KBE. Thank you, Mr. Chair.
Thank you.
Good morning, Chair Bobrowski, and thank you, Commissioner Glass. I'm also joined by Associate Commissioner Robin Kinney, who is on the call, who will also assist in walking through this emergency regulation and providing some information. I'm going to attempt to share my screen with you. so you can see the regulation. And if you will let me know when you can see that, I think there's a bit of a delay.
We can see Todd.
Okay, great. So I have here the draft that will be presented to the State Board of Education later today regarding the required face coverings in school facilities. As Commissioner Glass said, this is an emergency regulation. The first part of the regulation outlines the state board's authority to issue this regulation, and specifically, I will call your attention to KRS 156-160. The Kentucky Board of Education is charged with promulgating administrative regulations necessary or advisable for the protection of the physical welfare and safety of public school children here in the Commonwealth. So that's the authority upon which the state board relies to file this emergency administrative regulation. We're also, of course, in filing the regulation, complying with KRS Chapter 13A, and that's related to administrative regulations. That is the framework that the General Assembly has put in place for agencies filing administrative regulations, and that was most recently amended by the General Assembly during the 2021 session via Senate Bill 2. And the agency will fully comply with the requirements of KRS 13A in filing this regulation. Specifically, as Dr. Glass mentioned, that KRS Chapter 13A provides that emergency regulations are effective for 270 days from the date of filing. The agencies who file the emergency administrative regulations don't choose that amount of time. The logic behind that is that the emergency regulation would be in effect for the full amount of time, or can be in effect for the full amount of time that it would take for an ordinary regulation to replace it. However, here, the agency is not proposing that an ordinary regulation pick up at the 270-day period and replace this, and in fact has even indicated earlier in our statement of emergency that I'll scroll up to that we anticipate here withdrawal by the promulgating agency. So the agency can withdraw the regulation at any time during that 270-day period. So the first section of the regulation deals with definitions that we'll use throughout the body of the regulation. The first defines what a face covering is, material that covers the nose and mouth to prevent respiratory droplets from being expelled into the air. And then here are the criteria for the face covering, how it's secured to the body, that it can be made of a variety of materials, including cotton, silk, or linen. It shall be 2 or more layers, and it can be factory made, homemade, or improvised from household items such as a scarf, bandana, or t-shirt. So it's a broad definition that allows folks to fashion masks to meet this requirement and not require any one specific brand or type of mask, so long as it's covering the face and nose to prevent those respiratory droplets from being expelled into the air. Next, we define a person with a disability, and that's any individual with a disability pursuant to the IDEA, the ADA, or Section 504 of the Rehabilitation Act. And those are provisions that you all are very familiar with in school districts that you utilize in dealing with both students and staff. And then finally, we define a school facility. And a school facility means a building, an enclosed structure, or a vehicle that is owned, leased, or operated by a school district, and where 1 or more students are present therein. So you'll notice that this is going to mean that the regulation is only applicable when students are present. If, for example, a school bus driver has dropped off all of the students and she is the only person left on the bus, there aren't any students on there, then this regulation isn't going to be applicable, because again, this is under the board's authority to protect the health and safety of students. The next section on the regulation is requiring face coverings in school facilities. So all individuals, students, school employees, contractors, and visitors shall cover their nose and mouth with a face covering, which we previously defined, while inside a school facility. And again, school facility means when students are present. School district superintendents shall implement procedures to ensure that face coverings are worn in school facilities as required by this administrative regulation. School districts shall provide face coverings to individuals in school facilities who do not furnish their own face covering, but we've included in here that the district shall not be required to provide more than 2 face coverings to any single individual. That is to limit the administrative burden and expense on school districts. This administrative regulation shall not prevent a school district from establishing and implementing policies or procedures that establish face covering requirements in addition to those set forth herein. So if the school district wants to provide more stringent masking requirements that would require its staff to remain masked even when students aren't present, they are certainly free to do so. This administrative regulation does not prevent them from that. And then Section 3, we have a long list here of exemptions from required face coverings. So notwithstanding the requirement in Section 2 that everyone cover their face and mouth with a face covering in school facilities when students are present therein, we have all of these exemptions, and I'll walk through them. Children who are under the age of 2, any person with a disability whose disability prevents the person from safely wearing a face covering, or any person with a physical or mental impairment documented by a medical professional as preventing the person from wearing a face covering. Any person who is deaf or hard of hearing and is actively communicating, or any person who is actively communicating with someone who is deaf or hard of hearing and is able to maintain a distance of 6 feet from all individuals who are not members of the person's household. I think here we have communication, and that should be communicating, so I'm going to change that real quick. The next exemption, any person engaged in work that a state or federal regulator has concluded would make wearing a face covering a risk to their health or safety. Any person who is seated and actively consuming food or beverage. Any person who is obtaining a service that requires temporary removal of the face covering in order to perform the service. Any person who is required to temporarily remove the face covering to confirm their identity for security or screening purposes. That would cover folks who are maybe checking in your buildings. Any person who is giving a speech or broadcast to an audience and is able to maintain a distance of 6 feet from all individuals who are not members of the person's household. Any person who is in a swimming pool or other body of water. Any person who is actively engaged in exercise. Any person who is engaged in a lawful activity where federal or state law prohibits wearing a face covering. Any person who is sleeping or unconscious or who cannot otherwise remove the face covering on their own. Or, and this is the exemption that Dr. Glass mentioned, any person who is in an enclosed room and no other individuals are located inside the enclosed room other than individuals who are members of the person's household. So that highlights for you the regulation as proposed to the State Board of Education. I will ask Associate Commissioner Kinney to speak as well to some of the data that we have showing a rather alarming rise in cases of COVID-19 and hospitalizations, not just generally, but specifically within the population of individuals aged 0 to 18 years old.
Thank you, Todd, and thank you, members of the council. Again, want to echo the remarks that you've already heard of our appreciation for your willingness and service on emergency regulations. We've done that last week, and we've done it this week, and I appreciate so much your flexibility. Know this is a very, very busy time for you as superintendents, and want to thank you again for that. So as General Counsel Todd Allen has said, as part of our filing of the emergency regulation under KRS Chapter 13A, we are required to provide documentary evidence of the need for the emergency regulation. And while there is lots of information out right now that people have available to them, I wanted to quickly walk through the information that we'll be providing as part of the specific filing of this regulation. The commissioner started with a reference to really the alarming evidence of the increase in diagnosis of COVID-19 cases and hospitalization of children. We have provided as part of our supporting evidence on August 9th, the Kentucky COVID report indicated 269 new cases were reported for ages 18 and under in a single day, representing 20.1% of the total new cases on this one day. And as days pass, we are seeing similar alarming counts. This was just a snapshot taken of that one day. The Centers for Disease Control and Prevention, new admissions of patients with confirmed COVID-19 per 100,000 population by age group is also included. This is referencing Health and Human Services Region 4, of which Kentucky is a part of. It shows that that region, we are currently experiencing the highest level of hospitalizations of individuals between the ages of 0 and 17 years old. It's the highest we've experienced throughout the course of the COVID-19 pandemic. 12,414 total COVID-19 hospital admissions of this age group in this region, of which Kentucky is a part, between August 1st, 2021 and August 8th, 2021, which is just 1 week. Also included, and this has all been publicly posted for you to be able to look at in more detail, is a recent document dated August 6th, 2021, again published by the Centers for Disease Control and Prevention. And this document really focuses in on the COVID-19 Delta variant. The Delta variant is the most predominant strain of the virus currently, and the unvaccinated population, according to the CDC, is the greatest concern. Children younger than 12 years old, as you know, have not been approved to receive vaccination yet, so we are hopeful that that will happen soon. And only 34% of children between the ages of 12 and 17 in Kentucky have received the vaccination as of earlier this week. So that was a percentage given earlier this week by our Department for Public Health. In this publication, the CDC indicates that the Delta variant is highly contagious, nearly twice as contagious as previous variants, and that patients are more likely to experience severe illness. This CDC document concludes, given what we know about the Delta variant, vaccine effectiveness, and current vaccine coverage, layered prevention strategies such as wearing of masks are needed to reduce the transmission of this disease. This is a very busy time. I heard lots of superintendents talking about you've either started back to school or you're getting ready to. So this is a very busy time as we kick off the new school year in Kentucky. Unfortunately, we have also included in our documented evidence news releases from Kentucky and other states across the country that have started school, and as a result, these are schools that are districts that do not have universal masking requirements at this time, and unfortunately they have suffered from quarantine of both staff and students, and so we are seeing that as a news story being covered across the nation. Additionally, the Center for Disease Control and Prevention August 5th, 2021 guidance for COVID prevention is included as part of our supporting evidence. The CDC states explicitly, students benefit from in-person learning, and safely returning to in-person instruction in the fall of 2021 is a priority. It's a priority for us as educational professionals, and it's also a priority for our health professionals. In this document, the CDC recommends universal indoor masking by all students, age 2 and older, staff, teachers, and visitors to the K-12 schools, regardless of your vaccination status. And then finally, we've included a couple of reports, again, from the Centers for Disease Control and Prevention on the science of masking, and a February 10th, 2021 Boston University School of Public Health report on the benefits of masking. So I just wanted to share with you all that documentation is publicly provided, and you can provide, there's lots of additional detail in those documents, but these are the documents we have provided supporting evidence for the need of an emergency regulation. We also hope that this is another mitigation strategy in addition to other mitigation strategies that we know your districts are utilizing. And so again, focusing on masks today and under this emergency regulation, but still encouraging the vaccinations, the hand washing, the social distancing, testing, all those measures that collectively give us the best chance to remain in school in person with our students and staff. That's the additional information that I wanted to just share with you this morning. And of course, I'm sure Todd, the commissioner, are available to take questions at this time.
Todd, this is David Raleigh with LaRue County. I had a question just for clarification. So several times you mentioned that if students were not in the building. So does that mean that adults would not need to wear a face covering if students were not in the building, or does that mean that like if students weren't in that particular classroom or that area? Does that make sense?
Yes, it's in the building. So if you have a building where students are present, then masking would be required, subject to the exemptions that we talked about under this regulation. If students are not present in the building, then that's going to fall to the local board and the superintendent to determine what your all's policies and procedures are going to be around your staff masking in that situation. So we can think of, for example, the central office. When students aren't present in the central office, this regulation is not going to be applicable to that situation, and that's going to be under your control as the superintendent or what a local board may determine.
Okay, and a follow-up to that, in terms of providing mask breaks for our students, is that something that's left to the discretion of the local board, or would that be something that would need to be in the regulation?
So there's no specific break period provided in the regulation, but I will note that this regulation only applies to indoors. So if students go outside, that is not covered in this regulation. So if you took your students outside, that could be a period that you could provide a mask break.
Superintendent Raleigh, if I might add just to what Todd has mentioned on your first question around the masking regulations when students are not present, the authority that the state board is operating under for this proposed emergency regulation is narrowly focused on the health and safety of students. And so we felt it inappropriate to extend beyond that to staff. We want to make sure that our regulations are closely mirroring what the statute says the authority that the board has is. So that's why we haven't expanded it beyond that. So it would be, as Todd mentioned, it will be up to the district to decide how you want to handle adults.
Thank you.
Commissioner, this is Russ Tilford. I have a question for you. I always try to begin with the end in mind. So with that thought being shared, what metric will KBE look at to withdraw this regulation?
Based on the change to the motion that I mentioned, what we well, let me back up and restate this. The statute around emergency regulations indicates that they last for 270 days. And as I mentioned before, we hope not to have this in place for 270 days, and no one wants that. The regulation that we have also indicates that the state board at any time can come together and end this regulation. So that's what's in the regulation, and that's what's being directed by statute relating to how emergency regulations operate in Kentucky. What we're proposing adding and will recommend to the board at their meeting later today is in their motion to put in language directing that when CDC or DPH stop recommending universal masking for individuals in schools, at that very moment, that we call an emergency meeting where they will have the opportunity to rescind this. So that is the shift that we're putting into the motion that we're recommending that the state board adopt, that would trigger when the state board would come together to potentially pull back this emergency regulation.
But with the vast width of Kentucky is we're 400 miles from Paducah to Pikeville. With all the different counties and independent districts that we have, that will look different in place to place, community to community, district to district as we move across the Commonwealth. This doesn't look the same across all counties right now. For my county, we're a small county, 800 or 8,200 people. It only takes 16 cases for us to be red, but yet we're still orange. So for my community, it's still not a major issue at this moment. Not to say that it won't be next week or even later today, but I think local leadership needs to be able to make that decision based on what we're seeing. With the quarantine rules that are in place, if you're wearing a mask, both individuals wearing a mask, please correct me if I'm wrong, but if both are wearing a mask at 3 feet, you don't have to quarantine. If we wish to stay operational, if cases are widespread at all in your school community, you're going to have a mask mandate if you're going to stay operational. If you want to stay unmasked and implement the quarantine rules at 6 feet, you're not going to stay operational very long if you've got an outbreak of cases. So I really wish we could leave this as a local decision, let the governor's executive order be in place as it is. We all should follow that. But I really worrisome about the 270 days and it be a KBE decision that one size fit all solution is our best approach. So I do struggle with a lot of this.
I appreciate the points that you're raising, Superintendent Tilford. I think you raised really two issues. One is what is the appropriate trigger or metric by which this would come to an end? What we've proposed is something that we think provides clarity, and we can point to the CDC recommendations in our own Kentucky Department of Public Health. If those were to shift to take into account local variations in school districts, for example, we know that last year we had sort of that color-coded system that recommended different approaches to be taken depending on the community transmission. We haven't seen something like that from DPH presently. And really at the level of spread that we're seeing around the state, it wouldn't make a lot of difference if we had some kind of color coding shift. So that's where what our recommendation is to the board in order to provide that clarity around when this would end, to look to the CDC and DPH. Certainly as a body, you're able to recommend that the state board do something else. If there's a recommendation that you have around a different trigger or something different that you think that they should use to end the regulation and at what point that would happen, you're welcome to offer something like that to the board. On your second point, as to whether or not this should remain entirely a local decision or if this should be a statewide decision, really that's a policy determination, a matter of what your thoughts are or perspective around policy matters. I feel strongly that when it comes to matters of public health and safety, you have to have some consistency in how these things operate from district to district and community to community. It's the same reason that we have consistency around how health and safety operate in areas of public transit and how health and safety operate in restaurants and where people are eating. If it's all left to local determinations, what you have is variability. And this is a statewide concern, as Robin Kinney mentioned in her statement around the rationale for this. We need everyone to work together so that we can get this behind us. We have to stop messing around and fooling with this virus and put it behind us. And so we need to take the steps, in my professional opinion, need to take the steps statewide that are necessary to keep it out of our schools, to keep our students and our staff safe, and to prevent this from becoming an exponential spread that stresses our hospitals, puts more people on ventilators, and ultimately puts more people in the grave.
Well, again, just as a quick follow-up to that, I do appreciate the thought that there could be some trigger points considered by the board, and I would hope that y'all could, I know it's awful quick, but any consideration to trigger points where there are some local metrics that could be put into consideration rather than just being a blanket statewide one size fits all would be greatly appreciated, I believe. Thank you for your time.
Thank you. One possible solution to that is that this body, in whatever you end up recommending or statement that you send over to the state board, could ask that we consult the Kentucky Department of Public Health on a localized metric approach, similar again to the color coding system that we had in place this spring. And so that's something I would definitely defer to them on. Is it the right time to do that? Do we have enough variability across the state where that makes sense? But that could be a solution to the challenge that you put before us around what's the right trigger point for revising this decision.
Superintendent,
thank you.
Superintendent Tilford, just to clarify, I think the proposal that Commissioner Glass has made that the state board would immediately call a special meeting upon changing of the DPH or CDC guidance would address, I think, what you're talking about. So if DPH or CDC changes their guidance to indicate masking would be determined based on community positivity rates, that change would trigger the state board to come back and reconsider this emergency regulation. Because right now, that guidance is not based on community positivity rates. It's across the board, universal masking in all K-12 settings.
Commissioner, this is Dave Cox in Corbin. I don't know if you can hear me. I've got just a quick question. What time does the state board meet today?
They are meeting at 11:30.
At 11:30, so
Yes.
about an hour and a half. And I'll be honest, I did not get to review this as closely as I wanted to. I was out of the office yesterday. We had a million things going on. We looked at it today. I've got some of the same concerns that Superintendent Tilford has, and maybe educate me just a bit, Commissioner, if you would, as far as the 270 days. What would prevent the governor from, in 30 days, if our conditions are exactly the way they are now, from doing another emergency order? Is there anything that would prevent that from happening?
We had some changes to the statutes relating to the governor's authority on executive orders. Maybe we could have Todd speak to the limits on that and the governor's ability to re-up this when his executive order expires. I will note that the state board's authority is separate from 39A. The governor's operating under executive order power under 39A. This is under a different statute.
Yeah, thank you, Commissioner. I can do my best. I will say that, I don't represent the governor's office, so I'm not well versed in, what his authority may be for executive orders. The emergency regulation that's before you all is under completely separate authority of the State Board of Education to act. As Commissioner indicated, it is not under KRS 39A. That's the governor's emergency power that he relies upon for an executive order, and that was challenged, is subject to challenge right now before the courts and amended by the General Assembly. Our authority is completely separate under KRS 156-160 and the Emergency Administrative Regulation Statute, KRS 13A. I will, if it's helpful to you, share my screen and show you KRS 13A. And once again, this was amended by the General Assembly during the 2021 session. And you'll see, let me find the provision, the 270-day provision is set forth in statute, except as provided in paragraph B. Emergency administrative regulation shall expire 270 days after the date of filing, or when the same matter filed as an ordinary administrative regulation filed for review is adopted, whichever occurs first. We're not filing an ordinary regulation because we don't anticipate this lasting 270 days or beyond. But the 270-day period is set by the General Assembly for all emergency administrative regulations. And then further down in the statute sets forth the authority of an agency to, at any time, withdraw their emergency administrative regulation. But Again, that 270 days isn't something that we arbitrarily picked. It's set forth in statute. When an agency files an emergency regulation, it is effective for 270 days. I'm not sure that addressed your question. I'm happy to follow up if you have some follow-up questions.
I would just say this, and thank you, Todd. I appreciate your explanation as well. But from I guess from a layman's terms, I agree with the science behind masking. We're masking in our district. We have been for a while. We'll continue to do so. We would have done so had it not been for the governor's order, probably. But we don't start school until next week. But again, I'm not a lawyer or a doctor, certainly, but I guess committing to a 270-day mask mandate with the hope that it being rescinded rest with the CDC is not real compelling at this point in my community. And I'm just stating that, and I don't know if anybody else feels that way or not, but I have had numerous calls from parents that are taking their kids to homeschool, taking their kids somewhere just because of the masking that's going on right now. And Commissioner, I hate the position that you're in, because I can only imagine it's multiplied times 173 or 172, the position that we're in. You're dealing with every district. We're dealing with just ours. But there is a strong pushback out there for this in my community. We're going to do exactly what the governor said to do. And like I say, we probably would have done it beforehand. But I have to agree with Russ. I think on the local level, those triggers maybe should be accepted by our board and accepted by our community. I don't know. It's just my 2 cents worth. It may not make a bit of sense to anybody else.
Thank you, Superintendent Cox. I think you raised the same two issues again. One is, should there be some kind of different metric in place around where and when this ends? We're open to your feedback and suggestions, and we'll convey those to the board. Presently, we wanted to have something that was very clear. And if we point to the CDC or the State Department of Public Health, if either of them shifts their recommendations, then that triggers a board meeting where this is reconsidered. We think that that's clear, and clarity is important in as we try to navigate these contentious issues. So that's the rationale for it. But again, you as a body are free to recommend something else. And then on your second point, that you have a preference for local decision making around the state, again, that's a matter of a personal and professional opinion about how this should be handled. I've stated that when it comes to issues of health and safety, there is a strong rationale for some uniformity around having those things move together. It's not an individual, an isolated individual issue. It's not someone's personal preference if they have the virus and then expel it and give it to someone else. It's an other affecting issue. And so in those kinds of situations, I think it makes sense that we consider statewide uniformity in approaching it.
I completely understand your point, and that's the big problem with this whole issue. There's good points on both sides, and rational people will understand that. And I do appreciate the position you're in, and I hope you appreciate the position that we're in. And you've been in this seat, so you understand exactly what we're talking about.
Certainly, I think what we have is a conflict of positive but also conflicting values. We all want our kids to be safe in school. We don't want this virus to be transmitted to our staff. We don't want kids or staff to take it home. We're concerned about the Delta variant. All those things are real. And we also know that masking is an effective strategy at mitigating the virus in our schools. We've proven that this past year with the layers of mitigation strategies that we had in place. We've shown that Kentucky schools can be effective at keeping in-person learning going. At the same time, I understand that everyone is tired of the mitigation strategies. They would like to have this behind us. I certainly would have as a parent and Kentuckian and father myself. There's a concern that requiring a mask is some kind of affront to personal freedoms. So I understand those concerns as well. For us, we and I believe the state board will speak about this later. I know that they will. There is an obligation that we protect the students and that we put the students' safety first, and the in-person learning and how important that we know that is. We put that first. And so those are the values that are driving our recommendation on this regulation. Those are the values that are leading us to take it to the state board for consideration. So I respect and understand that there are positive but conflicting values on this. The values that are driving us relate to the health and safety of the students and ultimately keeping their in-person learning experiences available.
Hi, this is Kelly Reinsdell, Anchorage Independent, and I too, like David, appreciate the different lenses with which individuals are viewing this emergency regulation, and everyone's efforts to keep our students central to our decision making and their best interests. As we've experienced since March, I think it was 2020, when COVID-19 really began impacting operations of Kentucky schools, it can be a very rapidly changing landscape with the need for prevention strategies to be folded in and to be removed to allow students greater opportunity and access to activities as we can remove those. So I appreciate it. My concerns lie really with the speed with which this regulation is being considered on the heels of the governor's mandate, which if universal masking, is warranted for health conditions, we have that now in all Kentucky schools. And I'm concerned with is this the manner in which, and the agency which should promulgate or enact a universal masking regulation such as this in Kentucky. Certainly, if our state health officials believe that masking is required to protect the health and safety of students, we need to be looking at students not just in the public education setting, but in other settings as well. So I appreciate the differences of opinions. I appreciate everyone's concern for students. We had universal masking prior to the governor's mandate, and that was in response to local concerns, but we had a mechanism for when we would remove universal masking that was less than 270 days. And I understand KBE is willing to come back and withdraw it, but I too am concerned with the breadth of the state, and that this is maybe too far reaching in some areas, but is isolated also to public school kids, and I believe we'll lose students potentially to programs and to schools outside of our network. So that's all I have, really not a question, just wanted to let you know.
Thank you, Superintendent Ransdell. I understand the concern around the speed at which this is happening. I recall that when I gave those closing remarks at the KSA conference a couple of weeks ago, one of the things that I talked about was that all of us have to remain agile, pay attention to data, and then act according to how this situation is changing. So this is a dynamic situation. A month ago, 2 months ago, we all didn't think we'd be here, or certainly hoped that we wouldn't be here. And I remember the feeling of excitement and exhilaration when we were able to pull back the Healthy at Schools guidance, and the governor rescinded all of the protections, or all of the mitigation strategies that were in place. And we thought we were through this, and we're not. And so I understand that's part of what we're dealing with, is the confronting the reality of we're going to have to keep working on this a little longer. But that's the real reason for the speed of this, is that the dynamics of the situation, it's changing quickly and accelerating quickly. and where they're concerned from public health about running out of hospital space and the number of students that they're seeing come in with cases, and trying to prevent an exponential spread and further mutations of the virus that make it more difficult to control. So that's really the rationale for the speed. It is the dynamics of the situation. The virus is changing landscape, and how we're dealing with that is driving where this decision going forward. The question around the statute or around, who is the right entity to be enacting this? Is it the governor? Is it the Department of Public Health? Is it the Kentucky Board of Education? We rely on what's in the statute. So I don't make things up and just get to apply blind edicts to the state based on my whims. We look at what's in the statute that guides our authority and how we are supposed to act under the law in the state. It's clear from our reading of the state statute that a responsibility of the State Board of Education is to attend to the health and welfare of the students under 156, 160. And so that statute is what we're relying on as why the state board needs to be engaged, why the Kentucky Board of Education needs to consider this and to act. There are certainly arguments and reasons that could be argued around why the governor should do it, why public health should do it. We think we have responsibility under that statute. We're certainly paying attention to what the governor is doing, and our recommendations are based on science and from what we're hearing from our national and state public health officials. So there's an understanding, and we are aware of that. But the reason for KBE taking this up is based in law.
Thank you. And please know I wasn't questioning your authority to do it as Kentucky Board of Education. I was really, my comments were more akin to, if this is a need in Kentucky, it should be a broader entity looking at it so that it's impacting an even greater number if that is the need.
Right. Thank you. And please, the authority that I have and the board has gets questioned continuously. So I'm not offended, as I'm sure does yours. So we're used to it. None of us can survive very long with thin skins in the roles that we have. For the reason that it's tailored to schools and to students really is it tracks back to the statute again. That is the limit of the authority that the state board has. Whether or not there should be universal masking for all places at all times is outside of the scope of authority that we have. In this case, I think there's a good argument for targeting it toward the school-age population, because that's a largely unvaccinated group. We don't have an approved vaccine for students under 12, and then we know that there's a really low vaccination rate among young people. So those issues, I think, are some data that we would apply and say, in addition to the statutory element that gives the state board authority and control over this, that's data that we have.
Commissioner Glass, this is Tom Cochran, Johnson County Schools. I first want to say that I appreciate everyone's comments and concerns that have been mentioned today, and appreciate the pressure that you're under too, Commissioner. I'd like to follow up on what Superintendent Ransdale said, though, about the timing and the breadth of all this. Would it be an issue that if we could, a problem for us is to take a step back, and we have 30 days, commissioners, with the governor's order right now. If my math is correct, we have to about September the 9th before that order ends. Would it be an issue or a problem? Step back, take a breath, look at our data. As you talked about a month or two ago, nobody anticipated being here. We don't know what the next month what's going to happen. It could just as easily the Delta variant could be shipping out of here at that time, and there would be a need for such a mask mandate for the 270 days. Would that be an issue to slow down and then reassess in a couple weeks, 3 weeks maybe, to see where we are?
It certainly is an option. It is something that we have considered and that the state board has considered. So the state board could delay. The state board may decide to do that today. They could hold another meeting next week, 2 weeks after that, a month after that, and reconsider this. So that is an option. I think, again, what's driving us to this point is the shift in the virus itself, what data we're seeing. Robin Kinney mentioned earlier around really our statement around the need for this forms the basis of why we think the state board should act. But directly to your question, yes, it is. It's not a requirement under the statute that that the board do this now or a week from now or at some point in the future. So that's a policy decision that the board will consider later today.
Thank you.
Commissioner, this is Harry Burchett, Harrison County. Kind of on that same note, in not knowing, obviously a month ago, we weren't in the conditions that we are in today. I certainly agree that masks are required currently right now. We made that shift. We had a layered approach here, so we could mask in stages, and we were planning on opening school originally under what we would call masking while moving, and the option to lower your mask if you had adequate social space in the classroom as directed by the instructor. However, we made a shift earlier in the week before the governor came out with the mandate to full universal masking as a result of the local conditions. We work regularly with the local public health director to make those decisions and have conversations about what is going on here in the community. But after receiving this emergency regulation in our email or the online repository yesterday, about 24 hours ago, after I read that, I started doing a little research on it and wanted to look at the track of the Delta variant in countries that it had already been in. I think it was in other parts of the world prior to really taking a hold here in the United States. India might have been the first location, and then I think Great Britain has had a pretty good case of it, and other countries. But as I looked at those graphs and charts, it appears that it runs about a 3-month cycle from the start, really the start of the peak up the sharp incline, and then drops back off about that same on the backside as well. And from the base on each side, it's about a 3-month span. So that, again, I wasn't aware of the 270-day timeline that is spelled out in the statute. Wished I'd have known that prior to today. It would have answered some of my questions. I think that's statutory. But it looks like if we track similar to India or Great Britain, we may be in a total different situation in another couple months from now, because we may be close to a month into our start of this. And of course, obviously, I'm like Dave Cox. I'm not a medical doctor nor a lawyer, but I'm just looking at the data from other countries around the world. And I also believe, looking at our vaccination rates, as the total U.S. population, our vaccination rates are much greater certainly than India. It's at least 2 times what India's vaccination rate is, and I'm not sure about what it is compared to Great Britain. So just, I think, if our goal is to have students in person, in class, 5 days a week, and that's our goal here, because last year we had too many students that didn't choose that option. I think we have to have a measured and balanced approach to how we deal with this. And again, I think, maybe slowing down just a little bit and looking at this a little closer, we might be. We don't want to send the message that we're not about health and safety. Absolutely, health and safety is first and foremost. But to send a message that is health and safety for 270 days might also send another message that with unintended consequences that we don't want to happen. So. And it's just a comment, not really a question on that. Just wanted to throw that out there.
Thank you, Superintendent Burchett. I certainly am optimistic and would hope that we would see that same steep decline coming at some point in the future around the number of cases, similar to what we saw this summer. Wouldn't that be wonderful? Wouldn't that be wonderful to see that start to happen and to really finally put this behind us? That's not where we are today. I'm seeing 86% increase in national cases over the last 14 days, 75% increase in cases over the last 14 days. We're losing about 550 Americans a day to COVID. That's like someone shooting down 2 757 airliners every day. If some other nation had done this to us, we'd consider it an act of war and we'd be united behind stopping it. That's not where we are with this virus, but that's the way that that's how we would approach it if we were seeing those kind of deaths in another way. So I hope that we get into a situation where our cases are plummeting both in Kentucky and around the country, and this no longer becomes necessary. As has been mentioned, the 270 days is not something that I put in or that Todd Allen put in or that the state board wants to have in this. It's in the statute. When you run an emergency regulation, that's the number that you put in it. Again, we're open to different configurations on when that could be pulled back. We've tried to put forth something that's very clear around when that would happen, that conveys that it's not the intent of the State Board of Education, nor the commissioner, nor the Kentucky Department of Education to continue this for 9 months. That's something that none of us wants to have happen. But if we see conditions shift in the future, we also want to convey that we're paying attention to it, that we're absolutely willing and should be reconsidering this regulation if we see that drop in cases that you mentioned, that I hope we also see.
Thank you.
Okay, commissioners, we're kind of winding down. I guess we're entertaining questions from the body, and I really appreciate you taking the time out of today to explain it in detail to folks, especially around the table. But one question I guess that I've got hit with is, of course, is the 2-year-old mask requirement that's in the legislation, and I didn't understand where that was coming from. So I've got a lot of teachers that are concerned about a 2-year-old having to wear a mask. So can anybody address that?
We have the requirements that we have in here are closely mirrored to what public health is recommending. Todd, do you want to weigh in on the language and where that came from?
Yeah, I believe that's included in the CDC's guidance on masking.
So we certainly understand that as a practical matter, it's a lot of work to get 2-year-olds to do a lot of anything. And that it's a continuous effort. In childcare settings, we also have lower ratios in terms of pupil-teacher connections, and if you're dealing with infants and toddlers, it can be as low as 7 or 8 to 1. So that's or 4 to 1 in the case of infants and toddlers. So it's not the same situation as we deal with in a classroom where you've got perhaps 30 students to 1 teacher. So there's a greater ratio of adults to help supervise that. Although I think we all have to acknowledge that this is going to be a work toward trying to reduce the probability that we have a transmission of COVID-19. None of these things are guarantees. None of them are certainties. And we know that students, adults, infants, toddlers, kids that are in preschool, we're going to have variability in how often people keep these on and how they adhere to this and how safe we can be. So that's going to be a variable. Enforcement is going to be a variable. Adherence to the regulations is going to be a variable. But I think what we're working toward is, can we reduce the probability across the state? And that's why we've put this forward and why it aligns with the CDC.
Okay.
Hi, Commissioner Glass. This is Sheila Mitchell, Superintendent at Anderson County Schools. I'd just like to say thank you to all of you for your hard work. I know it's very difficult times for all of us trying to lead through unprecedented times, so we appreciate all your hard work and efforts. I have a question that relates to data. I think Superintendent Cochran referenced this earlier. In Anderson County, we collected our data very specifically over the course of the last several months, and the transmission rate within Anderson County schools was low to zero. We were very proud of that. We were in session for every week that we could be in session except one, and we worked with our local health department to make that determination. And we chose to take an extra week coming off of the Christmas break because we felt that it was appropriate and needed to ensure that we weren't spread the virus. And so our mitigation strategies, we felt like at that point were very effective. So I have a lot of data specific to Anderson County Schools utilizing the mitigation strategies that we put in place and felt them very effective for last school year. I also asked our administrative team and the teachers that worked our summer camps, of which we're very proud to say that we served over 800 children during our summer session. During that time, we were masked for 1 week. Outside of that, we were not masked at all. And our transmission rate was low to zero during that time frame as well. I understand that the variant is different. I think we all understand that, and I think we all respect that. We all understand the fear around that, but I think we all need to make sure that we're looking at our data and that we're using our incident rate and our how the mitigation strategies that we're currently using are impacting that, meaning that I believe every superintendent in the state is working very hard to ensure that mitigation strategies are in place to avoid the spread of the virus within the schools. I believe that for every superintendent in the state. And so I have to say that I was very happy to have that local control and be given the opportunity based on the data that we've collected to work with my board to make the decision for Anderson County Schools. Very quickly, it seems that that clearly has changed. We're very respectful and understand the executive order and appreciate the efforts and respect that. The question I have really is around the 270 days. I realize is written in reg, and it is something that we've had a lot of questions around, but has anyone from KDE and or I guess the Kentucky Board of Education looked at the research around what has taken place within the districts last year as well as over the summer to see what the spread is within the schools with the current mitigation strategies that we have in place?
Oh, absolutely. I've, like you, have lived in the research around school safety and COVID for the last 18 months. So absolutely, we have reviewed it thoroughly and continue to. I think I share your commendation of the people working in Kentucky schools and the students for the job that you did mitigating the virus. And we didn't see schools be vectors of transmission this past year. And credit to you and credit to all the superintendents in the state for leading on that issue. I think that one of the reasons for that is the layers of mitigation strategies that we had in place. So we were proactive about having efforts in place to keep our schools from becoming that. So I go back to, again, the remarks that I made at KASA a couple of weeks ago. We know what to do. We know what to do. We know what's effective based on what the research says and our own lived experience around how we keep schools safe. So we know the procedures that we need to put in place. This summer, we saw a decline in the positivity rates of cases around the state. Hallelujah, we were all thankful for that, and we were able to pull back from the mitigation strategies that we had in place. That's not where we are today, and this continues to shift. So that forms, I think, the rationale behind why the state board is coming forward with this potential emergency regulation that they'll consider. I support it because I think it puts us back to the proven mitigation strategies that we had last spring. Really, we're asking districts, or be requiring districts in this case, to make sure that they have in place the same set of mitigation strategies that we have shown are effective in Kentucky.
I appreciate that, and I agree. And you know, some of the same concerns around mask wearing and being in session were questioned last year when we were in session and doing quite well. Making sure that we were implementing all the mitigation strategies so that our children could attend school. So, I guess I would just like to be heard to say, I think a lot of us would like to be able to make those same decisions at the local level that we made last year. We realized masking in some circumstances is going to help us mitigate the spread of the virus, and we all respect that. As Superintendent Burchett said, at times a layered approach is extremely effective. And maybe there are times that we don't have to mask and we can continue to avoid the spread of the virus as well. So just on our behalf in Anderson County, and I would just like to say that we would like to be given the opportunity to try to do those strategies, use the data, work with our local health departments, and make those decisions together for our school community as well as our community at home.
I appreciate that, Superintendent Mitchell. I think one of the effects of creating some uniformity to the approach from district to district around the state is it really puts district on a level playing field and stops what I would call sort of a race to the bottom in terms of who can offer the lowest level of mitigation strategies that they can, where we have people shopping around trying to find the lowest and least safe option available. So again, I think it's a matter of policy preference or opinion around should this be a localized decision or should it be a statewide effort. I think when it comes to issues of public health and safety, you're dealing with things that need to be that we need to have some consistency around. Certainly, having been a former superintendent, I respect and would have pushed back against a lot of things that the state tried to come in and direct me in what to do and what not to do. But when it comes to protecting our communities across the whole state, I think this is one of the areas where we've got to be, we've got to consider, is it the right thing to do to have some consistency and level the playing field in terms of the strategies being used across districts.
Hey, Commissioner, this is Dave Cox again. Speaking to Tom Cochran's comments earlier, and you said it would be an option. I think everybody agrees with the point you're making, and the science is irrefutable. But the speed at which this has traveled to Superintendent Ransdale's comments also, would it be possible for this body to make a recommendation to hold off on a decision today as far as LSAC is concerned, and see where we're at 20 days from now, and so forth? To me, I think that would be much more palatable for my board and my community. And if things are going down, as Superintendent Burchett suggested may happen, and I too read that same, I looked at that same research, then maybe there's not a need for this. I just know that that based on what was filed yesterday, that there's a lot of people that are going to say this is a knee-jerk reaction to the fact that the commissioner, the governor may lose his powers, and we're trying to, I guess, enforce masks in such a way that would be absent what the governor wanted to do. And I probably didn't say that very eloquently, but that I've already had that suggested to me on multiple times since yesterday. And again, I will say this, and I already said it once, then I'm going to be quiet, but what you're doing is times 173 from what we're dealing with. So we respect what you're trying to do, and certainly in no way mean to try to question your authority. We're going to do what we're told to do. And I was the very one that asked you the last meeting, hey, let's come up with some mandates. Quit leaving the recommendations out there, and you all done that. But I just think if we could slow this down just a bit, we all may get to a point where we're very comfortable.
Thank you, Superintendent Cox. And I, having been in your role and also here at the state level, I just want to say that we're all under a lot of pressure and trying to find out what the right thing to do is. And there's no, like in our graduate programs that prepared us in how to be school leaders, this wasn't covered. Global pandemics was not one of the courses that we had to go through. So I appreciate those statements. Directly to your question, yes, the LSAC can recommend to the state board that you delay or that you stop. And so you're welcome to do that. That won't be my recommendation to them. I think it's important that the state board act under the authority that it has under law to put these requirements in place with some uniformity across the state. So we'll have conflicting recommendations versus what's coming out from the LSAC versus what's coming from the department, but that's okay. And I think it reflects where we are, the constituencies that we're trying to represent, the diversity of, again, positive, but sometimes opposing values that we're trying to manage on this. So you're welcome to make a motion, recommend, and vote how you see appropriate. I think for me, when I, again, go back to what's my primary charge, what's the state board's primary charge, to attend to the health and safety of students and to, in this case, maximize their opportunities for in-person learning. That's the driving value. That's the driving decision and where we're coming from, where I'm coming from.
This is Keith Hill over Glasgow, and I agree, Commissioner. I don't see the need to do this now. I'm not disagreeing with anything you said, but to rush this and push this through right now, I don't see how it benefits anyone. So again, I agree with what everybody said. 2 weeks from now, 3 weeks from now, we meet and discuss this again. So I agree with everybody else.
Thank you. I think it's been addressed in our conversation. So you have the ability to recommend that to the state board. So I think from a procedural standpoint, this is going to sound like a country song, but somebody make a motion.
All right. Sounds like we have it on the floor for us to discuss. Now, before we do stop, I do want to just thank Commissioner. You can tell around the table we have a lot of superintendents that are sitting here today, and a lot of folks that are watching us online. You know, there are issues and concerns, and I want to just, as chairman of LSAC, I just want to reach out and thank everybody that has put time, effort, and energy into what matters in your community, what matters in the state of Kentucky, and what matters most importantly for our kids and our schools community. So we all have a special niche for our schools in our community, and we want to represent those. And we appreciate everybody's input today, from the commissioner, commissioners from Dr. Glass to Julian Tackett being here. We appreciate you all taking the time to listen, to have our voices heard. But ultimately, you should be able to hear from this superintendent body, that our student and staff concerns are number one. They really are. And I sit back today, and this is probably the quietest I've ever been. But it just, when you sit and listen, you can hear the care in these conversations, and how it's being done. I know it's a local decision versus state decision. None of us will ever be happy. It doesn't matter what we do. But I think we got to keep that in mind, and the process and procedure will move us forward. So at this point in time, what we will do, we've had an hour and 15 minutes today with the commissioner and his answers. Are there any other specific questions I want to ask the body before we move to a motion? Okay. So what we will need to do at this point in time is, according to our agenda, it says requires a motion and a roll call vote. It says, do I have a motion to approve 702 KAR 1:195E face coverings in school facilities? Hearing no motion, we will now then take a look at our democratic rules of order to follow to see how we should move next and proceed. So according for the information that I have, it looks to me as if we would want to modify or to decide later. We have two options there to discuss motions. So we don't have a motion. So we're now going to move to a modification, so to be, about a motion coming from the LSAC body, if I'm reading this correctly.
Yes, Chair. So you'll need a motion to decide later. So to take note, so the action would be to postpone approval. So Todd can provide the preferred language, but it would be a motion to decide later.
Okay.
Yeah, so keep in mind that the LSAC's role is to make recommendations, to advise the State Board of Education. So, your motion should be around how this body would send advice to the State Board on this regulation. If that is to table the regulation to a later date, then that would be the way you would term your motion. But I'll leave that to you all to form your motion.
Chairman, could we make a motion for the board to look at this regulation, but put some parameters on what we are recommending be the changes in the regulation?
Is that your motion, Ms. Mitchell?
It's really a question versus a motion.
All right.
I think we need to decide as a group what those changes that we need to recommend would be, so that we're very clear on some of the points that have been made in our last hour and 15-minute conversation.
Okay.
Along that same line, I would encourage that our motion include KDE working with Kentucky Public Health to develop local metrics that might be put into place so that we do have some local metrics considered. Even though it would be universal across the state, it would have that measure of local consideration. I think that would be greatly appreciated by so many.
I agree with Superintendent Tilford, as well as the local metrics, or the local metrics, the incident rates, and the data to be considered for the local boards and or superintendent to work with the health department as well. That would be what I would like to put there.
So it sounds to me like we have that particular wording in the form of a motion. So if someone could put it that way to make a motion, then we will move forward and see how this moves.
So, Chair Bobrowski, based on what I hear, and Superintendent Mitchell can certainly correct if incorrect, but as I understand, what she has stated would be a motion to approve the emergency regulation and also instruct the State Board of Education and the Department of Education to work with the Kentucky Department of Public Health to develop metrics for future mask requirements based on local community positivity rates.
I don't know why we have to approve this today. I think what I've heard is the need to, we've got time to get information and have discussions and meet again before the need to make this recommendation will go through or approve this.
Superintendent Hale, the board will be meeting at 11:30 today to take action on the regulation. And so whatever recommendation the members of LSAC would like to make to the board does need to be included in some action today.
Okay.
Although I would add procedurally, you can take no action. You'll just send no recommendation to them.
Commissioner, just to educate me real quickly, you already told us what you're going to take forward to the state board, and certainly we all respect that. Regardless of what our recommendation is, the state board can choose to accept that or not, and that's probably what's going to happen. So in reality, our best option, I guess, at this point, if we don't agree with the reg as it's written, is just not to send a recommendation at all today. Let the action take its course.
I think you really have three paths before you. One is that you could recommend that the regulation be approved. That's been called for by the chair and was no one made that motion. A second path is that you could recommend that the regulation be approved with some changes. That's really what Todd just read to you, is that option. And then a third path is to either take no action or recommend a delay. So either one of those has the same effect. So I think because the chair has asked and called for a motion on that first pathway, there was no such motion. Now you're entertaining options either around approval with a modification or either that third path, which is to recommend a delay or simply to take no action. And in that case, officially, you're sending no recommendation, no advisement to the board on what you think they should do.
Okay.
I hope that clarifies.
Chairman Bobrowski, this is Russ Tilford. I move that we recommend KBE table this regulation and that we encourage the department to work with public health to develop some local metrics to be put in place for our school districts.
That's exactly what you said.
Okay, we have that motion on the table.
I'll second.
Was that Mr.
Keith Hale?
You gotta help me. I didn't hear that. David?
I'll second.
Okay, we have a motion. Any discussion on the motion? We have a second by Mr. Keith Hale. Any other issues, concerns about that? At this time, we'll have a roll call vote. Ms. Meredith.
Tim Bobrowski,
Tim Bobrowski, yes.
Harry Burchett,
Harry Burchett, yes.
Tom Cochran,
Tom Cochran, yes.
David Cox,
David Cox, yes.
Keith Hale,
Keith Hale, yes.
Sheila Mitchell,
Sheila Mitchell, yes.
David Raleigh,
David Raleigh, yes.
Kelly Ransdell,
Kelly Ransdell, yes.
Russ Tilford.
Russ Tilford, yes.
Thank you, Chair. All members present have voted.
Okay. Thank you all for a dialogue today. We appreciate it. We appreciate everyone's attendance. Unfortunately, some of us are starting school today, so we've got to get back to our schools. So want to wish everyone the best. If you've not started, good luck this school year. Commissioner, good luck today. We do appreciate you and your words of wisdom, as well as Mr. Allen's. We appreciate the back end of work that you all are doing. We know, and I feel very confident that a good decision will be made that'll be in the best interest of our kids. That's what we're here about, and I know what's going to happen. So we'll be flexible and adjust and adapt, as I would recommend for everybody to do this whole school year. So again, thank you. I will need to have a motion for adjournment, please.
Tom Cochran, motion for adjournment.
All right, we have a motion. Need a second, please.
Second, Dave Cox.
All righty. We'll see everybody. This meeting.
Thank you, Mr. Chair. Thank you, members.
Thank you.